Congratulations to our Casanova.
Oh.
Who got her first nursing job.
Thank you. Me too.
I'm so proud of you.
Champagne and coffee.
I don't want to go.
Way to start Friday.
I know. Woo!
Kassidy, our nurse, just put her first IV in. Hey, look at her. She's ready for her first nursing job. So we're so proud of you. What do you feel like you're going to bring from your experience here to the hospital?
I mean, so many
This is
things.
her glass of champagne, by the way, but now I'm just decided is now mine.
I feel like when I first started out here, I had no medical background. So even as simple as, physical touch with patients, just being able to comfort you guys every day and making you feel comfortable was a huge step. Just even getting comfortable touching patients, I feel like is huge. So just going into the hospital setting, it's going to be a lot easier for me to transition and, touch and be with the patient, make them feel comfortable. Just welcoming each and every one of the patients on my floor. So
I remember when she first started, and I would ask her to hold pressure if I saw if there was a little bit. She'd be like, no, push down. She's like, I don't want to hurt them, and I'm like, I just put a needle in their face. You're not going to hurt them.
I can't touch them. I'm going to hurt them.
And then I watched you over the course of the year just assert yourself, and I just had to fill out a letter of recommendation for her, and they said, what are 3 strengths and what are 3 weaknesses? So I was like, the weaknesses, I'm really sorry. I had to tell no, just joking. I literally put 1, and I was like, she's a perfectionist and really struggles with the learning curve aspect and needs to give herself more grace, that it takes time. But as the positive attributes, I said that innate leader. I said, this is a charge nurse in the making, and she is going, whatever you give her, she does better with responsibility. I think you do better with that. It just comes naturally to you.
I feel like this is such a fast-paced environment too, which helped me manage my time, which I'm going to have to do in the hospital. Just from charting to helping assist, from making sure that the front end was, are we on the same page? Are we communicating properly? Which is so huge. Transitioning into the hospital, I need to make sure I can delegate tasks and
totally
manage multiple cases kind of at the same time, which is just something you don't just learn on the cusp. It takes time.
Totally. In the first few days, you're just probably the first few months with me, it was wait, who was that? What did we do? How did we do that? And I'm spouting off so much at her. I'm throwing units at her, I'm throwing syringes at her, I'm throwing saline bags,
It was no joke with my charting skills. But she can handle it.
Too. Oh yeah, the charting skills.
Oh my God,
amazing.
I had no idea what to write, what's important.
Yeah.
And just my SBAR.
So much better, yeah.
Going into clinical, people were oh my gosh, you're really targeting what you need to know,
situation, background, assessment, recommendation. And from the beginning, I was if you're going to be a nurse, I'm going to teach you all this now, so that when you go into the hospital, you're just one leg up. So now what I'm going to do is tell you how I used to document when I was in the hospital, and every corner of the page always has the same things for it, and it made it really seamless. So we're so proud of Kassidy. I was her first IV, for the record, and I'm getting hydrated.
Lizzie's next.
Lizzie, Maura, we're making nurses out of this South Shore, okay? And we're just going to take care of you all. We're so proud.